unfortunately, because we were looking at claims data, it's really hard for us to ascertain why we think it was taking longer for certain cancers than other cancers. All we can do right now is perhaps speculate and use our clinical judgment or our research backgrounds to perhaps explore that. But it may be that essentially lots of cancers present with very nonspecific symptoms. And that's really one of the biggest challenges with diagnosing many cancers. You may come in with weight loss. You may come in with fatigue. You may come in with loss of appetite. These are things that are common across lots of different types of diseases. And they may be more common in certain kinds of cancers as well. But as a patient presents into the healthcare system, they may be presenting to a primary care provider or somebody who's a non-specialist. So they may not be looking for these types of symptoms or associating these non-specific symptoms to being related to a cancer situation. And that may be why we may be seeing some wide variability in the time to diagnosis across cancer, because they are often associated with different types of symptoms. But it may also be why, excuse me, it may also be why we're seeing perhaps it's just taking longer to diagnose these patients in general because of where they're entering the system. There's lots of perhaps innovations that are going on in this space that may help to improve this, especially given it's related to non-specific symptoms or to perhaps a delay in inefficiency of the healthcare system to vet these patients to the right diagnostic pathway. But I perhaps could see that there could be new interventions around the diagnostic, maybe perhaps tests or assays or perhaps biomarker types of genomic tests that could be explored that really help us improve and identify these patients, and could actually be in like the primary care setting where folks who haven't yet received or been referred to an oncologist or to a pathologist or to an endocrinologist who are the specialists who would then identify a patient who may be at risk. Perhaps this may be an opportunity to help speed up that process, or even in patients who maybe have had cancer, this may be an opportunity to track their cancer better, such that if they are relapsing, they can be identified sooner and prevent that relapse from being in a more severe state.